In this episode, we speak with Ankit Gupta, CEO and founder of Bicycle Health, a digital clinic to help people free themselves from opioid dependence. In 2017, after spending time in an orthopedic clinic to learn more about pain management and opioids, Ankit founded Bicycle Health to increase access to high-quality integrated medical and behavioral health care for people with opioid use disorder. Through a single app, Bicycle Health combines medication, behavioral health care, drug screening, therapy, and peer support. Before Bicycle Health, Ankit co-founded Pulse News, which was later acquired by LinkedIn, where he then served as principal product manager. He is also a co-founder of Docs and Hackers, a group of medical practitioners and software builders who aim to improve the practice of medicine with technology. I'm your host, RJ Lumba. We hope you enjoy the show. If you like the episode, click to follow.
RJ Lumba is the executive chairman of Market Insight Media and the managing partner of GrowthCap. He is the host of Great Entrepreneurs, a podcast for driven entrepreneurs and business owners. Our podcast covers all topics related to the entrepreneurial journey, from ideation to execution to optimization and to reaping the rewards of a well-run business. In the minutes ahead, we'll share with you unique insights and tactics from some of today's most accomplished and inspiring entrepreneurs.
Ankit, thank you so much for taking the time to chat with us today. It's a delight to be with you.
Yeah, same here. Excited to be here.
So Bicycle Health, it seems like when you started the company several years ago, you were coming from a completely different industry. You were previously at LinkedIn, and then before that, you were kind of a news media entrepreneur, it seems like.
Yep.
How did you go from news to health?
I got married to a doctor.
Aha.
So I, as you mentioned, started Pulse News with a co-founder, and we had a really good journey going from zero to an exit to LinkedIn and eventually integrating our technology with the LinkedIn newsfeed. And so after that, I wanted to take a step back and create something again that's hopefully a lot more impact oriented, hopefully a lot more in the vein of sort of helping people live better lives. And around that time, I got married to a physician. And so I just started seeing the patients she's seeing. We started talking about them. And it was really eye-opening how many patients with addiction issues, behavioral health issues end up being seen by her. And she's not even a specialist in that area. And so that's what led me to then start talking to people in recovery, start hearing their stories. And especially with opioid addiction, it becomes pretty obvious that the system is really letting people down. There's all these gaps that people fall through, whether it's not being able to see a doctor because there is no doctor available nearby who is able to provide treatment, to, insurance benefits are messy, to sometimes pharmacies don't cover medication. It was just all of these things. None of these things had to do with the care itself. Like the medications that we use are already generics. They've been around for decades now. The therapeutic model is well established. And so it was just a sort of light bulb, but the technology can actually help distribute the care much more scalably and much more seamlessly, just in the way that technology can actually help writers write content and the technology can help, people connect across the world. The technology can really help overcome all these barriers and help make it easier to access this care and stay in this care. And so even though it looks odd from outside in, I think just seeing the work my wife does and sort of talking to a lot of people just made it really obvious that I could use my technology skills to actually something that can make an impact.
Yeah, opioid addiction is such a widespread problem. It was top of the news, I would say, a couple of years ago, but it's kind of like waned a little bit. Is the problem still widespread and acute?
Millions of people struggle with misuse of opioids. Every year, the administration does a drug use survey, and the numbers are consistent. We've actually seen both ups and downs. So during COVID, overdose death rates went up by almost 30%. And that was the combination of the drug supply and just sort of the mental health condition of the country. And actually, in the last few data points, the trend is coming down. And so the overdose death rates have improved. And again, that's a function of, a lot more access to naloxone and kind of just awareness of the problem. And so it's gone up and down. But if you think about what it takes to overcome opioid addiction, it could take sometimes years to fully recover from opioid addiction. And it's also, unfortunately, really easy to stumble into opioid addiction through either recreational or prescription drug use. So this is still a massive problem. The administration just renewed funding for another 6 years for opioid addiction and sort of related funding measures. So unfortunately, I think this is a problem that, again, it's not just bicycle by ourselves. We're going to actually make a difference. This is something that public policy and states and governments and criminal justice systems and all of us need to really come together. Otherwise, it unfortunately will stay this way for some time.
Mhm. Now, walk us through how this happens, because I have a friend actually whose wife fell into addiction, and I don't quite know exactly how it started. So, presumably, someone is having issues. Is it anxiety and then they go to a doctor? How does it start?
Yeah, I mean, everyone's experience is unique. I certainly struggle with caffeine addiction, and I can't tell you how it really started, other than maybe I walked into a Starbucks one day. A lot of us, I think, struggle with addiction to work. And so I think everyone's journey is unique. What I've heard is often opioid addiction starts after some sort of an acute pain episode, like a fall, an accident, a surgery, you get prescribed opiates. And this has gotten better now, but in the olden days, a 30-day prescription or even a longer prescription was just the norm. And so the chances of developing opioid addiction after such a long use of opioids for opioid naive patients is really high. And so it could be after that. It could also be recreational use. You go to a party one day, or often it's actually kind of siblings, coworkers, friends, sort of sharing their pills with others. It also often starts just unintentionally. Fentanyl is in the drug supply for lots of drugs now that you get on the street. And so you could be addicted to fentanyl, even though you aren't specifically taking opioids, but you still get the similar withdrawal symptoms once you stop taking your drug of choice. And so there's multiple ways you get addicted, but you're right. One of the common use cases for opioids is to self-medicate a mental health issue. And, it's just hard to know what's correlation and causation, like what came first.
Mhm. So, how would you break out like the market in terms of, well, first off, are doctors starting to taper back on prescribing? Like, and how much has that gone down?
Quite a bit. I think the medical practice guidelines have become much, much stricter to essentially only allow chronic opioid use for sort of really acute cases like end of life cases or things like that. But for the most part, doctors have significantly reduced new prescriptions of opioids. Similarly, access to opioid addiction treatment has increased. So there was an X license that doctors needed to get on top of their usual controlled substance license. So in this country, any doctor could, with a DEA license, could prescribe opioids, but only about 5 to 10% of doctors had an additional license to prescribe opioid addiction treatment drugs.
Yeah.
And so that license got removed a couple of years ago. And so now a lot more providers get prescribed this medication. And just the public understanding has gone up, right? And I would really credit the Netflixes and the Hulus and the, all the sort of media of the world. I mean, this conversation we're having, like, I think more awareness just makes people just more afraid to sort of be on these medications for a long period of time. And so the problem has definitely stabilized, I would say. The chances of someone new getting addicted to opioids is much lesser now than it was a few years ago.
And so, would you still estimate the market to be, and it's strange to refer to it as a market, but like the number of addicted patients right now or prospective patients, it's in the tens of millions?
Yeah, presumably. I mean, there's about 10 million people, sometimes more, sometimes less, under different sort of annual surveys that say a self-reported misuse of opioids. And since this is a highly underdiagnosed condition, there's probably a lot more that are misusing opioids. From a diagnosis standpoint, I think there's about 2 or so million people that are diagnosed with opioid use disorder. And so again, how many people are undiagnosed but still at risk or using versus how many people are actually diagnosed and in treatment is really vast.
Mm-hmm. And so, what I gather from your solution is that you offer an easy, lower friction way of getting treatment. Can you tell us how maybe someone out there who is addicted can easily use Bicycle Health?
Absolutely. So when someone is ready to make a change, we try to make it as easy as possible to get started on treatment and stay in treatment. And so we have a virtual solution where patients can reach out to us. They can enroll online. We typically accept all forms of commercial insurance, Medicare insurance, and even some forms of Medicaid insurance. And again, the idea is to really try to work with all insurance plans to accept all insurance, but we most likely accept your insurance. And, we're in about 30 states across the country, not all 50 states because there's some regulatory hurdles, but we're in, majority of the states that people live in the US. And so you can reach out to us. And if we are in your state and we most likely accept your insurance, then you can enroll with us and you get connected to one of our medical providers. That's an in-house team of medical providers that we really try to make sure appointments are available same day or next day. So most likely you can get an appointment same day or next day, which is really important because when patients are coming to us, often they're in withdrawal and they need help right away. And the risk of relapse is really high if they don't secure an appointment and actually start treatment right away. And so you reach out to us, you verify your insurance, the state you're in, you get connected to a medical provider, and you can actually start treatment on the app through a live audio video call, same day or next day. And at that appointment, the provider who's really experienced in addiction assesses medical history, physical exam, psychosocial history, and comes to a diagnosis of opioid use disorder, if at all, and starts the patient on a prescription of buprenorphine naloxone or Suboxone. It takes about 2 to 3 days to fully offboard off of opioids and onboard onto this medication. And so in addition to the prescription, the provider also lays out what that plan looks like so that the patient can stop taking their opioids and taper up the dose of buprenorphine naloxone a little by little over the next few days. And all of this seems difficult, but the app that we built really makes it straightforward. So the app helps the patient follow this care plan really closely. If the patient has any issues, they can reach out to us, whether it's the provider, whether it's the care team, and get help right away. And we even go above and beyond to make sure the prescription is actually available at the pharmacy. So after this visit is done, the patient can go to a pharmacy and fill the prescription. And we've already called the pharmacy in advance to make sure the stock is available. So again, if the patient is in withdrawal, they can get seen quickly. They can actually go to the pharmacy. They can actually start the medication. And within 2 or 3 days, they can start feeling much, much better and essentially be on treatment. After that point, again, all of the visits happen online through the app. And so there's medical appointments that happen weekly initially, then bi-weekly, then monthly. We also offer thousands of support groups, which are just a really helpful part of our care model where patients appreciate being with other patients going through the same journey, but not necessarily talking about their addiction journeys. Could be grandparents bonding with each other, could be patients that have some kind of trauma, sort of supporting each other, could be patients just, meditating together or doing yoga together. So we really try to make sure it's not just medications that you have access to, but you also have access to this supportive community that really helps prevent relapse.
You would think that when the original doctor who's prescribing the opioid is talking to the patient, that they would give a warning, like, listen, you might get addicted to this. So you should know that here are the places you can go to get treatment, or here's Bicycle Health. Log on to this if you feel that you're getting addicted. Does that actually happen?
It seems like an obvious thing, but it happens pretty rarely, I would say. There's still a lot of stigma in the culture around addiction. And so patients typically don't appreciate receiving this kind of help until they are ready for it, because it makes people feel like they're addicts or they're being judged in some ways for their pain. And I can see that, but that's again cultural. If we destigmatize receiving these kinds of help, then it wouldn't really come across negatively. So that's some of the experiences I've heard from patients who are on opioids and don't necessarily want to be assessed for opioid use disorder. On the provider side, it's something similar where they have a hard time also addressing addiction in a way that makes it seem normal. And, our healthcare system really tries to squeeze the time doctors spend on patients. Like, how can you spend as less time as possible and bill as much revenue as possible? And so our providers are already strapped for time, and taking that additional 5 minutes to have a hard conversation when you have, 20 other patients to see just doesn't feel like a good use of time. Mm-hmm. So I think culturally, we're not there to be able to have these kinds of open conversations.
Mm-hmm. And is it the case that, I think I read the stat, was it's 30% likelihood that someone on opioids is going to become addicted?
Depends on the length of the prescription. Yeah, or if you have a 30-day prescription, 30 to 40% chance. But nowadays, people are getting shorter prescriptions. So it's much less likely. It's 5 to 10%. But still, what's interesting, there's some new research coming out that shows some risk factors that increase the probability of addiction. But there's no real sort of assessment. Like you and I can't take a test and it spits out a result that says, hey, if we get opioids, our probability of getting addicted is X. And so it's hard to know whether this patient will fall in the 5 to 10% or outside the 5 to 10%. Like there's no sort of standardized risk assessment for opioid addiction treatment. So this warning needs to actually be given to every single patient that starts on opioids.
It seems that your technology, your platform could be suitable for other types of issues. In essence, it's a communication tool. It's a network of kind of maybe providers or experts that can address patient needs. So what else are you looking into, or what are you heading into besides opioid addiction?
You're reading my mind here. Opioid use disorder was sort of the first step on this journey. You can call it the first app on the platform. But basically, what we have built is a way to connect providers with patients and provide holistic care that includes medication management, support services, therapy, and all of it delivered through a technology that actually works really well. We can scale this to pretty much any behavioral health condition. And so today, Bicycle Health is an opioid use disorder provider. We're actually evolving our service to become more of an opioid use disorder platform in the near term. But the long-term vision is to really become a behavioral health platform where patients should be able to receive any kind of behavioral health treatment in a similarly easy and effective way. And often patients have co-occurring behavioral health conditions, right? So you need to get treatment for 2 or more conditions at the same time. And the Bicycle platform can actually allow you to do that.
Mm-hmm. There seems to have been like a mini boom that happened in the mental health space and within digital health. We could break it down into different categories. How do you foresee the market playing out? Do you think there's going to be consolidation that continues to happen? And how are you playing within the market?
Yeah, I think there'll definitely be consolidation because at some point, these services become commoditized. Like scale can be a moat only for so long, and funding is opening back up again. I think fundamentally there are sort of 2 different kinds of conditions, like conditions where there's efficacious medication management and conditions which are primarily therapy oriented. And I think it'll be hard for a company to be able to do both well because it's just 2 very different kinds of staffing models, very different kinds of insurance reimbursement, very different kinds of sort of patient value propositions even. So I think that's one. I think it's also what patient population you serve. It's very different to serve an employer-based commercial patient population from a Medicaid-based population, from a criminal justice patient population that might be in a jail or a prison system. And so I think we will still see this space have multiple players, but the players will be specialized platforms in the class of diseases and the patient populations. Like I could see a really strong behavioral health platform for Medicaid that is very different from a behavioral health platform for employers.
Got it. We're heading into the tail end of the conversation. I have 2 final questions, but before we head into those 2, can you tell us the best advice that you could give to another entrepreneur having lived through your first journey with Pulse and now going through Bicycle Health?
I mean, I think I would say this is something that I live by and I learned at the design school at Stanford. I'm just a very big proponent of bias to action. You just go do stuff. That doesn't mean you have to do stuff badly, but you do stuff to learn, not necessarily do stuff to succeed. And so I just love kind of the user-centric design philosophy. And you can just keep taking action to actually make progress. Often entrepreneurs get stuck because they're trying to solve the entirety of the problem, or they want to find the perfect pitch email, or they want to find the perfect pitch deck. And I just really push my portfolio companies and my friends to just keep doing stuff to learn.
Excellent. Last 2 questions. One is, can you tell us about a person who has had a profound influence on you?
Oh my. I think many people, but recently there's a person called Carol Rabin. She was a professor at Stanford who started interpersonal dynamics and later created this course called Leaders in Tech, which I participated in. And it has really helped me build emotional intelligence, like help me understand how I'm feeling and how I can relate to others through the kind of swirl of emotions. And that's really helped me unlock a level of leadership that I didn't see or thought existed. And so I would say she comes to my mind first and foremost right now.
Excellent. Last question. Can you tell us about a charity cause or other endeavor that you're passionate about?
Well, I think my charity is opioid addiction treatment right now. In addition to healthcare, I'm also really passionate about education. My wife and I talk a lot about helping underprivileged kids sort of get great education. I recently became a father, and I'm really getting excited about sort of early childhood development and how we can really support children, especially build these sort of social emotional skills. And so, yeah, if I wasn't doing bicycle, I would probably be doing something around sort of education and helping people grow.
Excellent. Well, Ankit, want to thank you again for taking the time to chat with us today. It's been a wonderful conversation.
Same here. Thank you so much for having me on.